Well, what do we have here? This is coming off the Centers for Disease Control and Prevention off their website, in which they're asking for people to fill jobs. What type of jobs are you saying, Jeff C? And why should I care? Well, they're looking for public health advisor. For the quarantine program? Well, naturally, Jeff C, they'd be looking for that. Haven't you seen there's a pandemic going on? Yeah, but there's a little problem with that, of course, is that this was actually posted last November. In fact, November the 15th, 2019, to be precise. And you can check out the job ID here, HHS CDC D320 1064 0010. And then you're like, well, maybe they were just, looking for somebody to work, fill in a position where they could be the public health advisor in a quarantine program, because government's got to prepare for those things. So where was this location? Well, that's a good question. I'm glad you asked that. We have the locations provided here. We have Dallas, Texas, El Paso, Texas, Houston, Texas, Seattle, Washington, Anchorage, Alaska, Los Angeles, California, San Diego, California, San Francisco, California, Miami, Florida, Atlanta, Georgia, Honolulu, Hawaii, Chicago, Illinois, Boston, Massachusetts, Detroit, Michigan, Minneapolis, Minnesota, Newark, New Jersey, New York, the Big Apple, Philadelphia, Pennsylvania, and San Juan. Seems like a lot of job positions. So, Jeff, what are you saying? The CDC put out a bunch of job listings, availability for last November? Maybe they were thinking of hiring these people, over a period of time. Maybe we could check to see what the period was. Oh, isn't this interesting? Open period. So here's the salary. So they're offering from $51,000 to about $93,000 per year. And then they said the open period here is from last November 2015 to this May, the 15th of this May. Interesting, too. The series and grade, GS 911. Isn't that interesting? So, what can you say, right? I mean, it should be obvious what people, right? It should be obvious. I shouldn't, do I have to tell you? Do I have to spell it out? I don't think so. I think most people can figure out exactly what this is about. All you got to do is look outside or on your telly. Yeah, you can look there. That's where they want you to look. So the agency marketing statement. So let's read this. Just to be precise with the information here. Making it nice and big. The Centers for Disease Control and Prevention is an agency Americans trust with their lives. As a what? Global. A global leader in public health. Private corporation, too. CDC is the nation's premier health promotion, prevention, and preparedness. They love their P's. Their PPs. Preparedness agency, whether we are protecting American people from public health threats, researching emerging diseases or designing them, or mobilizing public health programs with our domestic and international partners, we rely on our employees to make a real difference in the health and well-being of people here and around the world. They just love you so much. They love you. They do. They just want to make you morally safer. The position is located in the Department of Health and Human Services, the HHS. the Centers for Disease Control and Prevention, CDC, of course, the National Center for Emerging and Zoonotic Infectious Disease, which is this acronym, which I'm not going to try and say, the Division of Global Migration and Quarantine, the DGMQ, Quarantine and Border Health Services. I didn't even know these ones. The QBHS, with various locations. Salary may be adjusted and to include the cost of living allowance, the COLA. You guys get the COLA with your CDC jobs. Of 10.4 or 10.64 for Honolulu, Hawaii. Salary may be adjusted to include a cost of living allowance, 3.27 for Anchorage. If you get anchored down in Anchorage. Actually, it wouldn't be so bad right now. I'd be like, yeah, sign me up, man. It'd be as far away as Alaska. Salary may be adjusted to include the cost of allowance here. You get another COLA if you're in San Juan, Puerto Rico. Term appointments may be shortened or extended for up to a maximum of 4 years based on needs of the agency without further competition. Subsequent employment for CDC positions must be through the appropriate competitive process or special employment program hiring authority. CDC is an equal opportunity employer. They're so diverse. Now here's the job summary. It's rather brief, really. Serves as a project representative for a program responsible for preventing the importation and spread of communicable diseases. So you're going to serve as a project representative for a program responsible for preventing the importation and spread of communicable diseases. Duties. Here's your duties. Now listen up here. Assist in planning and implementing a program for preventing the importation of communicable diseases from abroad and spread of these diseases domestically. Monitor disease trends and consult with senior leaders to ensure that appropriate measures are taken to prevent the introduction spread of communicable diseases by travelers, etiologic agents, or vectors. Provide technical assistance, consultation, and guidance to national, state, and or local agencies, health organizations, federal, state, and law enforcement agencies, airport and seaport activities, hospital networks, and private entities. What? So look at this. Monitor disease trends and consult with senior leaders, of course, because they're going to tell you what to do, to ensure that appropriate measures are taken to prevent introduction, spread of communicable diseases by travelers or etiologic agents. Etiologic, that's what I'll say. All right. Or vectors. Now, just think about that for a second. It's like, wait a second. So they were hiring all these people knowing that this type of stuff was going down? And isn't it interesting? Travelers, right? Provide technical assistance, consultation, and guidance to national, state, or local agencies. So on all levels of government, you're going to provide technical assistance. Health organizations, federal and state. So this is all the things that they have to, so provide technical assistance and guidance to national, state, and or agencies, health organizations, federal, state, and local law enforcement agencies, airport and seaport activities, hospital networks, and other private entities. Isn't that like a mouthful and a half? I mean, look at this job. Look what they're asking these people to be involved in. And it's like, well, this seems like this is just a gargantuan sort of project that they have to be involved in. Is this something new? It just seems a little bit, wow. And then the final thing here, ensure, I hope it's obvious to people. I'm sure it is. Anyways, ensure appropriate communication networks, planning documents, and emergency response protocols are in place. Test it regularly. Develop and present training to various government agencies and local partners on emergency response protocols, communicable diseases, and quarantine activities. And then they have the requirements, which I don't think you really need to know too much about. Maybe there's stuff in here. You know they would need U.S. citizenship and all that. And then they say DHS E-Verify system. Federal law requires DHS to use E-Verify system to verify employment eligibility of all new hires. And qualifications required. And they'll say what they need for qualifications. I'm just putting this up here so you can read it. I don't think this stuff is all that important. I mean, the qualifications and the requirements, although there's always things in there. How you will be evaluated once the application process is completed. A review of the resume and the supporting documentation will be made and compared against your responses to the assessment questionnaire to determine if you are qualified for this job. If, after reviewing your resume and or supporting document, a determination is made that you have inflated your qualifications and or experience, you may lose consideration for this position. And then they just tell you all that crap. Let's see if there's anything here. Benefits. Other information here. Additional selections may be made within the same geographical location, CDC-wide. The utilization of shared certificates with multiple centers of disease and control and prevention may be used from this vacancy announcement for specialties to include, but not limited to, applied epidemiology, behavioral epidemiology, chronic diseases, emergency preparedness and response, emergency infectious disease, environmental health, HIV, AIDS, immunization, infectious diseases, influenza, malaria, non-communicable diseases, outbreak investigation, sexually transmitted. There's a whole laundry list here. So, and then they're talking about veterans as well. Okay, so how to apply? And this is where people had to apply. Okay, so, you know, I encourage leave no stone unturned. I just don't want to read all the not super important stuff, at least the way that I see it. But, I mean, obviously, this is a very important document here to show to folks out there, if you know what I'm saying, that they had this job application out and it was for all these locations, and it's dealing with many, many things, especially dealing with infectious diseases and quarantine. And the period, of course, of this period here, which is, you know, again, we'll see. Does it play out till mid-March and then maybe mid-May? Is it around May 15th that we're going to see a bit of normalcy come back into play, and then maybe later it's going to stick around? The thing is about this job, though, that is interesting is that they said that that they can keep you on for a period of up to 4 years. So it gives this specific sort of open period, but it doesn't say, it says that they can be renewed over and over again, sort of thing. So this is very interesting. And I want to thank I can't even remember. I mean, there's so many people sending me these documents and stuff. So thanks so much, everyone, for sharing this. We're all going to try to do the best that we can, take this ball down the field, present it to people. I'll post a direct link for the document here and in the description below so that you can go and check it out yourself. And I would urge you to download it and send it out there, get it out. I mean, it's just, does it prove 100% something, you know? Well, it's more evidence to add to the massive pile that we have a lot of plans that were in motion that correspond directly to the timeline that is happening right now. So this is what it is, that they went and they had to hire a whole bunch of people to fill these positions for pandemic scenarios and drills and quarantines and infectious diseases and the whole kit and caboodle, exactly what's going on. So now somebody else can come and say, is this a normal thing for the CDC to put this out? Do they put this out every year? Huh? I don't know. Probably not. And then when they do put it out, do they put it out for this many cities? Because it's like if it was just Philadelphia and San Juan, say, for instance, you'd be like, yeah, okay, it's just 2 cities. But you look at the cities and the locations in all the states, right? And it's kind of the big, like the epicenters of a lot of what's going on. Michigan, of course, being front and center. New York, I mean, you can't get much bigger. California, of course, and plenty of California here. Chicago as well. I mean, you're looking at the Boston, Detroit. I mean, these are the biggest cities in Washington. I mean, they're the biggest cities. And this is where most of what is happening. So we got to do what we can do, folks. We just got to do what we can do. I'm not here putting up disinformation. I'm here showing you real facts of things. And you have to make your sort of, you have to evaluate this information yourself, process it, and then figure out what it means, and then get the word out, sort of thing. I mean, the best thing that we can do is try our best. Right? The best thing we can do is try our best. I mean, what we could do all together is just try to share this information and get it out to as many people as possible. And, put it together, present it with other really important information, and show, Event 201, Clave X, all these different things that show that the whole preparedness sort of document that we just showed earlier. Try to put all these things together. I'm going to try to do that myself and just present these things because they're facts. It's not like they're made up or they're speculation. No, they're facts. These things are real. They're there. So how do you explain it? And then you go to the sheeple and you say, well, how do you explain this? Does this make sense to you? This seems rather coincidental, don't you find, that they wanted to hire a whole bunch of people, right, to be public health advisors for a quarantine program? I mean, don't you find that a little bit weird since we're having the first major quarantine in world history kind of thing? I mean, isn't it just a little bit, isn't it just a little bit of a quinky dink that they just happened to hire all these people for all these cities and they had the job description and it fits the exact same timeline of what is actually going on right now, and that YouTube and Google and Facebook are censoring all this information and they're stopping people from showing what's, because they don't want people to see this stuff. Why don't they want people to see this stuff? That should tell you. I mean, people, you go to the sheeple and you say, look, they're censoring everything. Now, they put out a lot of false information so they can come in. They get their characters, say, drink bleach and stuff like that. And they do that on purpose so that the sleep will see it when they put on their television. They say, stupid conspiracies. Just bring on the police state, please. Mandatory vaccines, come on. We'll all stay home and just communism, please. Anyways. So, anyways, thanks so much for taking the time to listen to this. If you can, please do come and support me. Patreon links in the description. Greatly appreciate it. And if you can, just share this information. Get this video out. Share the document. Do the best that you can. Speak to as many people as possible. And get everyone questioning everything at all times. And then none of this is, then we have a chance. Anyways, all the best. God bless. See you on the next one, folks.